Namaskar everyone. Today in the quick review section, we will be discussing what are the post-insertion instructions given to the complete denture patients. This denture insertion appointment brings joy. The students are happy because they will get good grades. The clinician is happy because he will get the pending payment. And the patient is happy because he will get the new set of dentures. But don't forget to give these instructions which are important for the success of the denture. Now, right from the first appointment, we should be able to make it clear to the patient that complete denture is just an artificial substitute and it can never be as same as the natural teeth. So first are the initial sensations which bother the patient. First is patient may feel the dentures very bulky. No matter how thin the dentures are, patients feel bulky. This can cause tongue cramping or patient may feel a bit of gag. You have to explain to the patient. Second, when the patient first wears the denture, he may feel loose. Okay, so we have to tell him that he has to learn to keep them in place with the muscles of the cheek and the tongue. That will come slowly and steadily. Third, too much of saliva. So patient will have excessive salivation initially. Patient has to avoid pooling of the saliva. He has to swallow again and again. This will help to stabilize the denture. Next is the appearance. Patient may feel strange to look into the mirror because of the added cheek and the lip fullness. Last is how to wear them. We as a dentist have to train the patient to insert and remove the dentures. We will have to explain to the patient that after a few weeks, the oral tissues will become adjusted to wearing of the dentures and these problems will subsequently go. The second instruction is regarding the speech. The wearing of denture, it affects the speech of the patient. Patient may have difficulties while speaking, especially pronunciation of certain words may change. Okay, the good thing is that this is a temporary difficulty. It will go away around 2 to 3 weeks. Okay, we should encourage the patient to speak more and a bit slowly using the dentures. We can ask him to practice reading aloud while reading the newspaper or a book. Okay, so this will help to overcome this difficulty soon. The third very important point is how to eat with the dentures. Patient has to learn to eat with the dentures. It is not same as with the artificial teeth. So first we will ask the patient to take soft diet initially. Avoid sticky and hard food for a few days. Avoid biting with the front teeth. Very important. Then how to eat with the dentures? First, cut your food into small pieces. Chew with your back teeth, posterior teeth. Chew slowly on both the sides, bilaterally. This will prevent the dentures from tipping and also any kind of trauma to the underlying mucosa. Once the patient has learned and practiced, then he can switch over to the coarser or the harder food. One more thing, patient should be aware while taking very hot food because as the denture covers all the surfaces, so it may cause burns. The next point is when and how to wear the dentures. First, as a clinician, we have to train the patient to insert and remove the dentures. We can ask him to do so in front of us so that he is comfortable in doing so. Then we should always ask him to put the lower denture first, okay, followed by the upper denture. Then regarding the night wear, avoid night wear. Why? Because dentures should be placed outside the mouth to provide rest to the mucosa and the supporting tissues. Okay, so what he has to do? First, take out the dentures before going to the bed, rinse them nicely and keep them safely in the denture box. The next very important point is caring for the dentures. The mouth and the denture both needs to be cared. If we talk about the mouth, first, patient should be asked to brush his gums, tongue and the palate with a soft bristle brush or cotton. This is done to remove the plaque. Okay, this prevents any kind of fungal infection. Then patient should be encouraged to massage the mucosa. This stimulates the circulation and keeps the mucosa healthy. For the denture, first patient should use denture cleanser. These denture cleansers are available in tablet or powder form. One tablet or a pinch of powder in water can suffice. 30 minutes soaking is enough, or what the patient can do, he can put the denture cleanser in the water while soaking overnight. Patient should use denture brush. You know, this denture brush has two types of bristles: soft bristles for the impression or the inner surface, hard bristles for the polishing or the outer surface. Patient should be asked to avoid toothpaste or detergents because this can spoil the denture. Recall and follow up: how and when to do. The first follow up is done after 2 days. 48 hours is ideal. We will check any kind of soreness if it is present, and we will do the occlusal adjustment. The second follow-up is done 2 to 3 weeks. If the patient is not having any kind of problem in between, we will again check for soreness and resolve any kind of problem patient is having. Then followed by 2 to 3 months follow-up, again we will check the response of the dentures. Now a few very important points that should be explained to the patient that he should not dare. First, he should not keep the dentures outside. Okay, dentures should always be immersed in normal tap water in the denture boxes safely. Second, he should not do any kind of self-adjustment and self-repair, with the common adhesives which are available in the market. Then he should always visit the dentist if any soreness is present. Okay, the dentures may need some relief. Okay, then he should always visit the dentist if any non-healing ulcer is present that needs diagnosis. We should give these instructions in the written form to the patient. This really helps. Okay, so that's all for the topic. Making a request to please like and share the video. You can give your topics and your feedback in the comment section. Wish you success today and always.